is Karen O'Donnell, and I am an occupational therapy assistant student at Mott Community College. And today we are going to be working with a 6-year-old boy who sustained a C7-8 gunshot wound. He is in the acute phase. On his right side, he has a loss of voluntary movement and some reduction in touch and proprioception. On his left side, he exhibits reduced pain, reduced thermal, and some reduction in touch awareness. The levels of C7 and above are all intact for both motor and sensation. Movements possible for him are elbow extension, ulnar and wrist extension, wrist flexion, finger flexion and extension, and some thumb movements. He is going to be entering the first grade, so the activity we will be working on is fine motor, some sensation, and proprioception. The activity will be done with him laying up in bed, but you could also do this activity laying prone depending on where he is in that acute phase of his spinal cord injury. What we're going to be doing today is playing with a sponge guy, and this is the sponge man, right? And what we're going to do first is, because he's got loss of proprioception, we're going to have his right hand up on the table in his visual field so he can see that and have it pushed down on the table a little bit. And what I'm going to have Gavin do is, Gavin, I'm going to have you scoop up one of these, and I'm going to have you put it in the sponge guy's mouth. Can you do that? Good job. You see he ate that up? Want to put the other one in there? You get it in there? Good job. Excellent. And then if we wanted to go ahead and grade this activity down, we would go ahead and use something that's
flipped over.
Oh, there. How's that?
Okay.
If we wanted to grade this activity down, we could go ahead and use something that's easier for Gavin to pick up. So Gavin, could you go ahead and scoop up one of those pink balls for me? In there? Good job. You want to do another one?
I'm going to try if I can fit 3.
Okay. Excellent job. So if we wanted to grade it up, we could then go on to a smaller cube. Can you pick one of those up for me with your left hand? Stick it in there. Good job. We're also using different tactile sensations. We've got these cubes, and then we've got the fuzzy little pink balls. And the small spheres, yes, and the smaller cubes. If we wanted to also work on some grip and grasp, we can also see if Gavin could open the SpongeBob mouths guy. Can you see if you can open him up? Excellent job. Good job. Okay. And then we could eventually move on to the tennis ball man. And he's a little harder to do, so as we progress, we could eventually move on to him. Do you want to go ahead and put something in his mouth with this hand over here? Is that one? Good job. I like it. And with this activity too, that's also would be grading it up, making it a little harder for him. Hopefully eventually he could do the tennis ball man himself. And since he's going into first grade, these activities are going to help him with his fine motor, sensation, squeezing glue, squeezing paint, holding onto a cup, different tactile sensations, and also some of his grip and grasps. And that would be our activity for our 6-year-old spinal cord. Thank you.